Is it possible to prevent diabetes? Let us start from the question of prevention of type 1 diabetes. No effective and safe intervention currently exists to prevent type 1 diabetes. Clinical trials aimed at halting the autoimmune destruction of pancreatic beta cells are being conducted. However, there is some evidence that overweight and a high growth rate in children are weak risk factors. Healthy lifestyle that avoids both overeating and a sedentary lifestyle are recommended for high-risk groups. Those include not being breastfed, being the firstborn, being born by caesarean section and having an older or obese mother. A cure for type 1 diabetes is being actively sought. Preventing or delaying it in those known to be at risk is also a priority. Slowing down the autoimmune destruction of beta cells and protecting those cells that are still active are achievable goals. Several studies are underway using interventions such as 1. Oral insulin in people known to have markers of islet autoimmunity. 2. Trial with drugs already used, for example in psoriasis, to prolong beta cell life and 3. Use of peptide immunotherapies to retrain killer T cells, the lymphocytes that are involved in the mechanism of type 1 diabetes. Prevention of type 2 diabetes. There are a number of factors that influence the development of type 2 diabetes. The most influential are lifestyle behaviors commonly associated with urbanization. Research indicates that a majority of cases of type 2 diabetes could be prevented through healthy diet and regular physical activity. A healthy diet includes reducing the amount of calories if you are overweight. Replace saturated fats, e.g. cream, cheese, butter, with unsaturated fats, e.g. avocado, nuts, olive and vegetable oils. Eat dietary fiber, e.g. fruit, vegetables, whole grains. Avoid tobacco use, excessive alcohol and added sugar. Regular physical activity is essential to help keep blood glucose levels under control. It is most effective when it includes a combination of both aerobic, e.g. jogging, exercise and resistance training. Reduce the amount of time spent being inactive. Factor that influences the development of type 2 diabetes is lifestyle behaviors associated with urbanization. These include consumption of unhealthy foods and inactive lifestyles with sedentary behavior. Lifestyle modification with physical activity and/or healthy diet can delay or prevent the onset of type 2 diabetes. IDF recommends physical activity at least between 3 to 5 days a week, for a minimum of 30 to 45 minutes. IDF recommendations for a healthy diet for the general population. Healthy diet. Choosing water, coffee or tea instead of fruit juice, soda, or other sugar-sweetened beverages. Eating at least 3 servings of vegetable every day, including green leafy vegetables. Eating up to 3 servings of fresh fruit every day. Choosing nuts, a piece of fresh fruit, or unsweetened yogurt for a snack. Limiting alcohol intake to a maximum of 2 standard drinks per day. Choosing lean cuts of white meat, poultry or seafood instead of red or processed meat. Choosing peanut butter instead of chocolate spread or jam. Choosing whole grain bread, rice, or pasta instead of white bread, rice, or pasta. Choosing unsaturated fats, olive oil, canola oil, corn oil, or sunflower oil, instead of saturated fats, butter, ghee, animal fat, coconut oil or palm oil. A particular threat in developing type 2 diabetes is the consumption of high sugar foods, sugar-sweetened beverages. Ways to lower blood sugar levels naturally. Your body usually manages your blood sugar levels by producing insulin, a hormone that allows your cells to use the circulating sugar in your blood. As such, insulin is the most important regulator of blood sugar levels. However, multiple factors can impair blood sugar management and lead to hyperglycemia. Internal causes for high blood sugar include when your liver produces too much glucose, your body makes too little insulin, or your body can't effectively use insulin. The latter is known as insulin resistance. External factors include dietary choices, certain medications, a sedentary lifestyle, and stress. Blood sugar management is especially important for people with diabetes. Chronically high blood sugar levels can lead to limb and life-threatening complications. 1. Exercise regularly. Regular exercise can help you reach and maintain a moderate weight and increase insulin sensitivity. Increased insulin sensitivity means your cells can more effectively use the available sugar in your bloodstream. Exercise also helps your muscles use blood sugar for energy and muscle contraction. If you have problems with blood sugar management, consider routinely checking your levels before and after exercising. You break up your sitting time every 30 minutes for just a few minutes throughout the day. Some of the recommended exercises include light walking or simple resistance exercises like squats or leg raises. Other useful forms of exercise include weightlifting, brisk walking, running, biking, dancing, hiking, swimming, and more. In fact, any activity that regularly gets you up and moving, regardless of the intensity, beats a sedentary lifestyle. Try aiming for 10-minute exercise sessions 3 times a day for 5 days, with the goal of 150 minutes per week. 2. Manage your carb intake. Your carb intake strongly influences your blood sugar levels. Your body breaks carbs down into sugars, mainly glucose. Then, insulin helps your body use and stores it for energy. When you eat too many carbs or have insulin function problems, this process fails, and blood glucose levels can rise. People with diabetes should manage their carb intake by counting carbs and being aware of how many they need. Some studies find that this can help you plan your meals appropriately, further improving blood sugar management. It's important to note that low-carb diets and no-carb diets are not the same. You can still eat some carbs when monitoring your blood sugar. 3. Eat more fiber. Fiber slows carb digestion and sugar absorption, thereby promoting a more gradual rise in blood sugar levels. There are 2 types of fiber, insoluble and soluble. While both are important, soluble fiber has explicitly been shown to improve blood sugar management, while insoluble fiber hasn't been shown to have this effect. A high-fiber diet can improve your body's ability to regulate blood sugar and minimize blood sugar lows. Foods that are high in fiber include vegetables, fruits, legumes, whole grains. The recommended daily intake of fiber is about 25 grams for women and 35 grams for men. That's about 14 grams for every 1,000 calories. 4. Drink water and stay hydrated. Drinking enough water could help you keep your blood sugar levels within healthy ranges. In addition to preventing dehydration, it helps your kidneys flush out any excess sugar through urine. Avoid sugar-sweetened options, as these can raise blood glucose, drive weight gain, and increase diabetes risk. 5. Implement portion control. Portion control can help you regulate your calorie intake and maintain a moderate weight. Monitoring your serving sizes also helps prevent blood sugar spikes. Here are some helpful tips for managing portion sizes. Measure and weigh your portions, use smaller plates, avoid all-you-can-eat restaurants. Read food labels and check the serving sizes, keep a food journal, eat slowly. 6. Choose foods with a low glycemic index. The glycemic index, GI, measures how quickly carbs break down during digestion and how rapidly your body absorbs them. This affects how quickly your blood sugar levels rise. Glycemic index. The GI divides foods into low, medium, and high GI and ranks them on a scale of 0 to 100. Low GI foods have a ranking of 55 or less. Both the amount and type of carbs you eat determine how a food affects your blood sugar levels. Specifically, eating low GI foods has been shown to reduce blood sugar levels in people with diabetes. Some examples of foods with a low to moderate GI include bulgur, barley, unsweetened Greek yogurt, oats, beans, lentils, legumes, whole wheat pasta, non-starchy vegetables. Furthermore, adding protein or healthy fats helps minimize blood sugar spikes after a meal. 7. Try to manage your stress levels. Stress can affect your blood sugar levels. When stressed, your body secretes hormones called glucagon and cortisol, which cause blood sugar levels to rise. Exercise, relaxation, and meditation significantly reduced stress and lowered blood sugar levels. Exercises and relaxation methods like yoga and mindfulness-based stress reduction may also help correct insulin secretion problems among people with chronic diabetes. 8. Monitor your blood sugar levels. Monitoring blood glucose levels can help you better manage them. You can do so at home using a portable blood glucose meter, which is known as a glucometer. Keeping track allows you to determine whether you need to adjust your meals or medications. It may be more helpful to track your blood sugar in pairs, for example, before and after exercise or before and 2 hours after a meal. This can show you whether you need to make small changes to a meal if it spikes your blood sugar. 9. Get enough quality sleep. Poor sleeping habits and a lack of rest can affect blood sugar levels and insulin sensitivity, increasing the risk of developing type 2 diabetes. 10. Eat foods rich in chromium and magnesium. High blood sugar levels and diabetes have been linked to micronutrient deficiencies. 11. Maintain a moderate weight. Even a 5% reduction in body weight can improve your blood sugar regulation and reduce the need for diabetes medication. Maintaining a moderate weight promotes healthy blood sugar levels and reduces your risk of developing diabetes. 12. Eat healthy snacks more frequently. Spreading your meals and snacks throughout the day may help you avoid both high and low blood sugar levels. Snacking between meals may also reduce your risk of type 2 diabetes. Having smaller, more frequent meals throughout the day could improve insulin sensitivity and lower blood sugar levels.